We are seeing a lot more younger people, especially under 65, as we, as a society, probably are getting a little bit heavier. We're putting more demand on our joints. We're also much more active than we used to be, and people are less tolerant of living in pain like they used to be. So people are seeking hip and knee replacement sooner. Preventive medicine or treatment prior to surgery includes physical treatment, which I would consider as bracing or physical therapy, oral medication, including anti-inflammatory medications, Tylenols, prescription pain medications, and then injections. And there's really two main types of injections that we do in an arthritic situation. That's cortisone shots and what are known as hyaluronic acid or gel shots. There is a market out there for stem cell injections and biologics. However, in the arthritic knee, unfortunately, they have not been shown to be beneficial, so we've really steered away from those because of cost and because they're not working as well as we had hoped. In terms of the procedure itself, with a total or partial knee arthroplasty or replacement, the incision is directed over the front of the knee from roughly the top of the kneecap down to the shin bone. We simply resurface the area, so it's not a true replacement of a large amount of bone in the knee. We really are just removing the arthritic cartilage in a small wafer of bone and putting a new cap over the femur and the tibia, and then we use a plastic tray known as polyethylene that replaces your old cartilage. In the hip, it is similar, where the disease is located in the ball and socket of the hip joint. We go through our approach preserving as much muscle and soft tissue as possible. We remove the head from the hip joint, we replace that with a stem and a new head, and then we put a new metal shell on the cup side of the pelvis with, again, a plastic liner known as polyethylene to represent your new cartilage. Technology has really improved in the hip and knee replacement world in the last 10 to 15 years. We've also seen a great advancement in the plastics and the metal and other materials used, such as ceramic hips, which have shown really good long-term wear. And some of the new data on the newer polyethylene plastics in hip and knee has shown up to 90% retention rate at 25 years, which is great because we're not revising people and people aren't having failures after 15 to 20 years like they were.